namely that antidepressants often do not do what they promise and are in fact causing harm to many.
Dr. Steve Hotze is suing over Obamacare's employer mandate.
It's time for a wellness revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctor.
Now, Dr. Stephen Hotze.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. Welcome back to the program. And of course, you can always download all of our podcasts at hotzepodcast.com. That's Hotze podcast.com. Okay, ladies, this podcast is for you. We are talking about the miracle hormone. It is called progesterone, and I cannot sing its praises enough. And I've got Dr. Hotze here to explain more about the wondrous value of progesterone and how it can help you. Dr. Hotze.
Thanks. Ladies, do any of you all have problems with irregular menstrual cycles or heavy periods or premenstrual symptoms or restless sleep or anxiety or panic attacks? You have a problem with fluid retention and weight gain premenstrually. Have problems with infertility. All this can be related to progesterone deficiency and progesterone decline as a woman matures and ages. So let me explain. In a perfect world, when a woman has a menstrual cycle, it's 28 days. Day one is the first day of the menstrual period, which in a perfect world would last 3 to 5 days and be mild to moderate. During that time, when she starts to menstruate, her ovaries now start to make estrogen hormone, which is a proliferative hormone. And it affects every cell in the body, including the brain cells, not just the uterus. But it does cause proliferation of the inner lining of the uterus, which has been sloughed during the last period. And that begins to build up in mid-cycle when a woman ovulates. At that area where she ovulates at mid-cycle on day 14 or 15, that area is called the corpus luteum, will begin to make progesterone. She continues to make estrogen, but now she's making progesterone to balance out the estrogen to mature the inner lining of the womb, preparing it for a potential pregnancy. So the proliferative hormone is estrogen. The balancing hormone, the restraining hormone is progesterone. And those two hormones, when they're in balance, women feel wonderful. Okay. Progesterone means promoting gestation, promoting pregnancy. So it's the hormone that promotes the pregnancy by maturing the inner lining of the womb. Now, as a woman marches through her menstrual life, by the time they hit their mid-30s into their 40s, the ovaries begin to produce lower and lower levels of progesterone. While estrogen levels may fall too, they don't fall as dramatically as progesterone, so they come into a problem known as estrogen dominance, or the other side of the coin is progesterone deficiency. They become deficient in progesterone, so estrogen becomes the dominating hormone, which can lead to the buildup of the tissue in the inner lining of the womb, so the periods become longer and heavier. They get cramping, breakthrough bleeding. And this can cause a host of problems with the premenstrual symptoms of the fluid retention, weight gain, headaches, breast tenderness, fibrocystic breast disease, and other various symptoms. So progesterone is a very important hormone that inevitably declines as a woman ages until a woman hits menopause, when she quits making from her ovaries any estrogen or progesterone at all. But progesterone is a very important hormone, and as I mentioned, it begins to decline in midlife, around the age of 30, 35, 40, in that range. As a matter of fact, as women march through their menstrual life, they will have anovulatory cycles. What does that mean? An means not ovulating. Every month, there'll be some months, women, as they move into their 40s and towards menopause, they won't ovulate at all. They don't make any progesterone. That's why they get, sometimes women will say, well, sometimes I'll get a very heavy period. It'll last maybe 8 or 10 days, and then the next month it'll be shorter, and I don't know what's going on. Well, 1 month she ovulated, 1 month she didn't. 1 month when she ovulated, she made progesterone to balance the estrogen. The other she didn't. And what happens is, as a woman moves towards menopause, she'll have multiple anovulatory cycles and maybe not quit ovulating altogether. And that's when she gets these heavy, heavy periods, and she gets fibroid developing in her womb. She ends up begging the OB-GYN to help her, and he's always got an answer, and it has to do with a scalpel or a knife, and hysterectomy is always his answer. But the reason we have that problem is because the hormones are declining and they're imbalanced, and progesterone is deficient. So those can be solved. Progesterone deficiency can be solved early in a woman's life as soon as she begins to have these symptoms, premenstrual symptoms of mood swings, fluid retention, headaches, breast tenderness that she gets premenstrually, and these heavier periods. As soon as that happens, start taking progesterone day 15 through 28 to balance out the estrogen. That can be a godsend for a woman. Now, this can also happen right after a woman has a child. This may happen to a woman in her 20s or 30s after children. We've seen it very commonly. Women will come in and say, I did fine after my first child, but after my second child, I never bounced back. I've had all kinds of problems. I can't lose weight. My metabolism's gone down. I'm fatigued all the time. I can't think clearly.
We hear that a lot.
And mood swings and all that. And that's because during pregnancy, the ovaries are turned off. Why? Because the baby's placenta is making all the hormones. And interestingly enough, the hormone that promotes gestation, progesterone, is the primary hormone that is made in the womb. So in the last trimester, a woman makes very high levels of progesterone. And that's why women oftentimes, as they move towards delivery, they'll all of a sudden get a burst of energy. And they get this, they feel like they're going to clean everything up, and they have this glow of pregnancy. And that's caused by the progesterone.
However, what happens right after they have the
But
baby?
as soon as they have the baby, the placenta is delivered, and there's a precipitous drop in the hormones. Now the ovaries have to turn back on, and they've been shut off for 9 months or thereabouts. And what happens then is that if they don't turn back on and make the hormones, they may be sluggish in turning on, then a woman can have a host of problems with fatigue and get baby blues, they call them, postpartum depression. Next thing you know, some conventional doctor throws them on a bunch of antidepressants and begins to ruin their
tragic.
life. It's tragic. When all they need is progesterone. And let me tell you, I have 5 daughters, and those 5 daughters have had 18 children. I've got sons with children too, so we have 23 grandkids, but 18 of those were born to my daughters. And after every one of the pregnancies, I made sure our daughters had progesterone after every one of the deliveries. I made sure they had progesterone in the room. I said, don't even tell your OB-GYN, they won't understand. Take your progesterone. And they took it starting right then to make sure they had good levels of progesterone. And most of my daughters, frankly, were on natural thyroid as well, and had no real problems with the pregnancies, and did very well. Well, what happened when we put them on the progesterone, they never had any postpartum blues. They never had none of them in 18 pregnancies had any postpartum depression. And so we encourage women at our office here at the Hotze Health and Wellness Center that are childbearing age and are pregnant to make sure that they take natural progesterone after they have that baby, because there's going to be a precipitous drop, and that's what leads to the postpartum blues or the postpartum depression. So anyway, progesterone is very, very important. And let me tell you what else progesterone is important for. It's very important for fertility as well. So if a woman doesn't make enough progesterone, the placenta doesn't make enough progesterone to promote the gestation, then women can have problems with infertility. It's in combination with low thyroid. This low thyroid and low progesterone are very common causes of, or caused by low levels of progesterone. So progesterone deficiencies can cause infertility. They can cause premenstrual symptoms. Progesterone is a cancer preventative. In a study in 1981 by Johns Hopkins School of Epidemiology, they did a study of women and measured their progesterone levels, and they followed these women for 20 years. The women that had low progesterone levels, either due to the fact that they just had bad ovarian production, there was some mechanical reason, they just didn't make progesterone or had low levels of progesterone. When compared to women that had high levels of progesterone, the women with low levels of progesterone had a 500% increase in their risk of cancer of the breast, and 1,000% overall in all cancers. fourth thing progesterone does, it helps with the utilization of thyroid hormones at the cellular level. It helps the cells better assimilate the thyroid hormones. And remember, thyroid hormone is what enables your cells' power plants to produce and use energy. So you have to have good thyroid function intracellularly within the cell, not just what's in your blood, but what's in your cell in order to enable your cells' power plants to produce good energy. If you produce good energy, optimal levels of energy, you're going to be a high voltage individual and you're going to be a live wire. But if you produce low levels of energy, then you're going to be a low voltage individual and you're going to be a slug. That's just the way it is. So we want to make sure in everything we do, we maximize the ability of your cells' power plants, the mitochondria, to produce high levels of energy. Progesterone also has a soporific or a calming effect, a sleep effect. So women that have problem with sleeplessness, insomnia and all that, they get back on progesterone and they find they can fall asleep. It calms their nerves and they do wonderful. It also is very important in mood swings. So as women progesterone levels fall and they have estrogen dominance and progesterone deficiency, this is when women begin to have these panic attacks and these anxiety attacks.
Mm-hmm.
And
I hear that a lot too.
And I've known women, they end up going to their doctor, they throw them on antidepressants and anti-anxiety medication, sleep medication. No woman has anxiety attacks or panic attacks or mood disturbances because they have low levels of antidepressants, low levels of anti-anxiety medication, or low levels of sleep medication in their body.
Amen.
When you felt well, you weren't on all these foreign chemicals that are toxins and poisons, which poison your cells, are toxic to your body, cause your mitochondria, your power plants to produce low levels of energy and make you sicker quicker. These things are not helpful, and they're not the cause of your anxiety, your panic attacks, or sleep disturbances. It's a change that's occurred in your body, and it can be easily corrected by replenishing your body with natural progesterone. Bioidentical. When we say bioidentical, what we mean is that it's identical to the molecule that your ovaries made. It's the same identical molecule. So your body thinks it's the same. It's really an anti-aging hormone if you think about it, because we age, you lose your hormones. If you want to have a better life as you mature and you age so you feel young, you want to make sure you replenish your hormones. This goes not only for females, but for males as well. Women get fluid retention and weight gain very commonly around their premenstrual. And this can start 1 or 2 days before. It can go all the way, it can work back to a week, even 2 weeks. As soon as they hit mid-cycle and they start having these problems, well, progesterone is a natural diuretic. It causes the relief of any fluid retention in your body. Another important effect and benefit of progesterone is in brain healing and in brain injuries. As a matter of fact, people that have concussions and brain injuries, there are many doctors, neurosurgeons, and other trauma specialists that give IV progesterone to the patients that helps relieve the swelling in the brain. So, and finally, for those individuals that have migraine headaches or headaches, particularly for those headaches or migraine headaches that occur premenstrually, it's not because you have low levels of Imitrex or Cafragot in your body or some other $50 pharmaceutical drug. Those drugs don't solve the problem of the migraine. Migraine headaches can be caused by low levels of progesterone deficiency. So if you have migraines that are cyclical and occur routinely right around your menstrual cycle or just before, then those are more than likely going to be hormonal. If you have migraine headaches that occur anytime during the month, they could be due to low levels of magnesium. And you can tell us a little bit about that, because when we had, what was the doctor's name? Magnesium Miracle.
Carolyn Dean.
Had Carolyn Dean on.
Yes.
She wrote the Magnesium Miracle, and I had Stacy read this several years ago, and I said, Stacy, she had problems with migraines. I said, have you tried progesterone? Yeah, but it didn't really work. And everything. I said, well, maybe it's magnesium. Here, Dr. Dean talks about magnesium being a common cause of migraines. Why don't you try it? And how often were you having migraines?
So I was having them a couple of times a month. basically, at least.
Were they debilitating?
Absolutely, they were debilitating, and I had to take a pharmaceutical drug, or at the time I thought I had to take a pharmaceutical drug just to mask the symptoms so that I could just stay at work.
And what were you taking?
I was taking Zomig, which is a triptan drug, and there was no generic, so I had to pay $50 per pill, and I had sort of resigned myself to that I would have to take that for the rest of my life, even though it had side effects of stroke and different things. I know stroke was one of them.
At least she didn't have a migraine. She just had a stroke.
Yeah, exactly. So
she didn't die of a
but
migraine.
for people out there with migraines, if you don't think there's any other way, you are going to try those pharmaceutical drugs. So I'm very grateful that it turned out to be a deficiency in my body for magnesium. And I know that the progesterone helped as well. I think they both work together.
Well, listen, the magnesium, and I'd recommend 800 to 1,000 milligrams a day of
That's what I take.
magnesium glycinate or magnesium citrate. And so this has been about 2 years, right?
2 or 3.
And
I'm starting to lose track. I mean, I haven't had a
so-
migraine or had to take a pharmaceutical
How many,
drug.
in the last 3 years, how many migraines have you had?
I really haven't. Every once in a while, I've had a kind of a bad headache, some stress
So you think
related,
about
very
that,
minor.
and you had migraine headaches for how long?
Well, all my life.
Okay, you think
I've had it all my life.
ever since, was it since puberty or since
Since
before?
I was a child, and then I think once I became an adult, there were different triggers as I got older.
So anyway, Stacy is a prime example of a woman who, for decades was on medication to treat a migraine headache, which doesn't cure the problem.
No, it never would cure it.
Remember, something's causing the problem. Rather than treating the symptom or masking it with a Band-Aid drug,
Right.
like all the conventional doctors do, get at the root problem. You think magnesium's in it? Compare the price of magnesium compared to Zomig.
Exactly. I mean, it's amazing. And then magnesium has so many other benefits
Yeah.
too. I mean, it's just
Well, anyway,
obvious.
magnesium is something you should try, and it can be a godsend, and it's inexpensive. I wonder why the doctors and pharmaceutical companies aren't pushing magnesium.
because they can't patent it.
They
why.
can't patent it, can't make any money on it.
Right.
The other thing that can cause migraines, by the way, is food allergies.
Mm,
Common foods: wheat, corn, egg, milk, yeast, soybean are the big six. But any food can cause food allergies, and one of the food allergies, very commonly, is migraine headaches. So you may,
That's true.
if progesterone doesn't solve the problem, or magnesium, it may be a food allergy on that. So those are some of the benefits of progesterone, and I hope that if you have any of these symptoms or want to correct any of the problems that we talked about, and let's just review what we talked about. We said that progesterone is very important. We didn't talk about bone health.
Oh, and we devoted a whole show to bone health
Yeah,
recently. So
bone
and how
health,
progesterone
it
helps.
helps promote bone regeneration, and that's very important to help prevent osteoporosis and osteopenia. It is a very important hormone, and here's something else you had mentioned. I know in that previous podcast that you had osteopenia in your
That's
30s,
right.
and we got you on progesterone
And vitamin D.
and magnesium, and all that. And so,
And that helped as well. So I mean,
how long
it's
did
just,
it take to correct it?
Yeah, let's see. I had it done when I first came in. That's when I found out I had osteopenia. Then they put me on the vitamin D and the progesterone and the other vitamins. And then I took it again in a year, and it had been reversing. So that's really encouraging that in just a year of taking it to see those results was very encouraging.
Remember, progesterone is important to help prevent infertility and help maintain good pregnancies, to help resolve PMS, which is caused by low progesterone, to help prevent cancer, to strengthen thyroid function, to strengthen bone health, help you with your sleep, help you with fluid retention and weight gain, help you heal brains, particularly if you've had an injury. It can be used for that, and it's very important for moods, anxiety, and depression. It can help relieve that because it calms you. And finally, if you got migraines and headaches, it can be a godsend. So that's one of the key ingredients. As a matter of fact, I would say at the Hotze Health and Wellness Center, we really built our health and wellness center. I'd say what really grew it were two key ingredients, and that was natural progesterone. When I started giving that back in 1996, it transformed women, and they loved it, and it just changed their lives. And the other thing was natural thyroid. So those two components have been a huge part of building the practice. So if you're not on natural progesterone and you're suffering from many of these symptoms, of difficulty thinking, poor sleep patterns, weight gain. You've got fatigue. You got body muscle aches. You got irregular periods. You got fibroids. You got fibrocystic breast disease. You've had infertility problems. All migraine headaches. You've got osteoporosis. Any number of different problems. If you have these, it may be that a tincture, a little progesterone, could go a long way to helping restore you to your health and wellness.
Well, and Dr. Hotze, thank you for being such a visionary too, and for recognizing years ago the positive impact that would have on women. And now you know why I was so excited at the beginning of this podcast about the benefits of progesterone. And it's so easy. And if you're out there thinking, do I have symptoms of low progesterone? Would that be able to help me? So easy to go to our website, Hotze, HWC.com. That's HOTZE, HWC.com, and take our symptom checker. And then you can also call our office for a free consultation as well. Well, it's a pleasure having you here today. We're so glad that you joined us today here at Dr. Hotze's Wellness Revolution.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.